This presentation is on the migrants and threat to healthcare in Malaysia. I will be emphasizing on the solutions to the case mentioned, which are in the aspect of health insurance coverage, in monitoring migrant health, and in developing appropriate policies and legal framework for migrants. Migrant inclusion in universal health coverage is a human rights imperative, for the purpose of protecting the health of migrants for the collective social progress and regional economic prosperity of a country. The International Convention on the Protection of the Rights of All Migrant Workers and Members of Their Families has emphasized migrants' right to receive any medical care that is urgently required for the preservation of their life or the avoidance of irreparable harm to their health. In Malaysia, all foreign workers are mandatory to be covered by the private medical coverage scheme, called the Hospitalization and Surgical Scheme for Foreign Workers. The scheme costs a premium of 120 ringgit and a total coverage of 10,000 ringgit for use of any health services in the public health system. Whereas the migrants that are categorized as refugees are covered under the Refugee Medical Insurance Scheme, which costs 164 ringgit annually per refugee for hospitalization, and a surgical coverage of 10,000 ringgit. Since 1997, all procedures related to medical examination of foreign workers are closely monitored and coordinated by the Foreign Workers Medical Examination Agency. Malaysian government made it mandatory for all potential foreign workers to undergo full medical examination at their home countries prior to employment. Medical examination report issued by the home country is valid for 3 months from date of examination, and employers are encouraged to have their workers re-examined in Malaysia prior to the beginning of their employment. After being accepted for employment in Malaysia, all foreign workers have to undergo medical examination annually, as medical report is required by the Immigration Department for renewal of the work permit. Medical examination should be conducted approximately 3 months before the worker's work permit expires. While for new arrivals, it will approximately be 9 months after their entry into Malaysia. The Employment Act 1955 were amended to include protection of foreign workers, which includes the duty to furnish information of migrant workers, and the power to the Director General of Labor to inquire into complaints from migrant workers. To regulate the import of labor due to socio-economic and political factors, policies are adopted to include the imbalance of labor market, to improve on the national security and foreign relations, to reduce the high incidence of irregular migration and to manage the legal and social infractions by immigrants. Recruitment agencies were established and bilateral agreement with specific countries were signed to regulate the inflow of immigrants and to reduce irregular immigrants. Guidelines were developed for recruitment and employment of foreign workers, by identifying economic sectors and jobs which may employ foreign workers, in identifying source countries and recruitment procedures and costs from each of these countries, in outlining particulars about job tenure, and in outlining eligibility, rights and responsibilities of foreign workers and employers. This is to encourage legal recruitment of migrant workers and reduce the number of irregular immigrants. Thank you.